Hello, Mr. Smith.
Hello.
How are you today?
Good.
My name is Ashley. I'm going to be the nurse examining you, okay?
Mm-hmm.
Let me just wash my hands and then we'll go ahead and get started. Okay. Did you have any concerns about today at all?
No.
Okay, great. Well, like I said, my name is Ashley. It's good to meet you.
Nice to meet you.
Now, I'm going to tell you about everything that I'm doing here to make you more comfortable with the exam, alright? And I'll let you know exactly what I'm doing before I do it. And we'll get through it, okay?
Mm-hmm.
Now, the first thing that I assess is just walking on you. I take a look at your color, the color of your skin, whether you're pale, whether you're flush, whether you're sweating, things like that. Normal is just going to be normal for ethnicity skin, dry, not flaking, but dry. I shake your hand, feeling for strength and also your temperature. Your body can be warm or cool depending on the temperature of the environment, but today it's rather warm and you're warm, so it's fitting. No excessive moisture. I'm asking you questions and you're answering me. That tells me that you're awake and alert, which is good. So now I'm just going to take a quick look at your head here. Let's see. Head symmetrical. Take a big smile for me. Face seems to be symmetrical as well. Hairline is pattern normal for you. Nothing unusual with that. Hair is soft and evenly dispersed for the most part. If we go ahead and take a little pinch out of there, we're not pulling out any excessive hairs. It's less than 6, so that's going to be normal for us here. I'm going to take a look at your fingers here. Once again, your hands are nice and warm, smooth. There's no ridges, no clubbing, nothing unusual about the fingernails. They're smooth and hard. They are firmly adhered to the nail beds. Hair pattern on the arms is normal. Look, excellent. Next, I'm going to have you go ahead and lean back for me. We're just going to take a look at your chest here, okay? Okay. So we're going to pull this towel up to keep you nice and covered. Now, when I'm looking at your chest, I'm going to go ahead and just look and make sure that it's equally rising and falling. There's no bumps or lesions or anything like that. Just like we didn't see any lesions on your arms or your head or your neck. So, let me just take a quick look here. Alright, everything looks good. Take a deep breath in for me. Alright, everything's nice and symmetrical. We're going to go ahead and feel for the pulse of the point of maximum impulse, which is going to be at the 4th and 5th intercostal space on the left midclavicular line here. Now it's not visible, but often in people with thicker chest walls it's not. So we're going to go ahead and take a feel for it here. And that should just be a normal bounding pulse, but a lot of times in adults or people with thicker chest walls, you're not going to be able to feel it. So, got that. We're going to go ahead and take a listen to you in 5 different spots here. And this is just listening to the different areas of the heart. Each heart section is going to sound like lub-dub. Lub-dub. It's not abnormal to hear extra sounds in there, which are called split heart sounds, and that's just the valves closing at just barely different times, and sometimes you'll hear that different sound. Now the first point that we're going to listen to is going to be the 2nd intercostal space on the right hand side, and that's going to be your aortic area. The second one is going to be on the 2nd intercostal space of the left hand side, which is the pulmonic area. third is going to be Erb's Point, which is the third intercostal space on the left-hand side. Fourth is going to be the fourth intercostal space on the left-hand side, and that's the tricuspid area. And the fifth is the fifth intercostal space, and that's going to be the mitral area, also on the left-hand side. Alright, so that sounds good. Now, next I'm going to have you sit up here for me so that we can take a good look at your back. Just have a seat right there. Okay. So first we're going to go ahead and take a look at thoracic expansion. And the way that I'm going to do that, I'm going to put my hands on your back and I'm going to have you take a good deep breath in, okay? That there. I'm just going to pinch a little bit in the middle here and I'm going to have you give it a good deep breath in. That's perfect. Now with the normal breath expansion, it's going to, your fingers are going to come apart between 5 to 10 centimeters. So that's perfect there. I'm going to go ahead and do a little bit of percussion here and just take a listen to your back. Okay. Now the lungs should sound pretty resonant. We're going in a pattern here so that we don't miss any spots. As we get down to the bases, they're going to be a little more dull for noise, but that's okay. Next we're going to check for tactile firmness. And the way we do that is you put the bony prominences of your hand, and I'm going to have you tell me 99 every time you feel my hands on you.
99, 99, 99, 99, 99, 99.
Okay. Now, normal for that, you're going to be able to feel the vibration all throughout the chest cavity, and then as you get lower, it's going to become a little more dull. Alright, so next I'm going to take a quick listen to your lungs here. And the same thing, it's going to be systematic, going from the same spot on one side to the other here. I'm going to have you take some good deep breaths for me. I'm going to take a listen for one whole in and out breath for each spot. Excellent. I'm going to have you come back to my exam table here. And we'll get you covered up here. Okay, I'll lean back a little bit more and then I'll see you go on the sounds in the front. I lost you. Okay. Now same thing, I'm going to keep you nice and covered, but I am going to have to put my stethoscope directly to your skin so I don't have any interfering noises in there when I'm trying to listen to your lungs. I'm going to start listening up in the neck area, and up here we're going to hear high-pitched noises. Alright. And then I'm going to keep listening, same pattern as before. A full in and out on each side. And over the smaller airways, we are going to hear the higher pitched sounds, and over the larger airways, it's going to be softer, lower pitched sounds. Alright, excellent. Next, we are going to go ahead and take a look at your vasculature here. I've got you at about 30 to 45 degrees, and I'm going to have you turn your head this way for me. And we're looking for the jugular vein and the carotid artery. Now the jugular vein, there's going to be two distinct pulsations, whereas with the carotid, we're only going to see one. Then if you can't see it, then if you just decrease the elevation a little bit more. Alright, and there it is. Perfect. We're going to go ahead and feel for brachial pulses. Do that simultaneously on each arm here. Alright. And the radial pulses as well. Okay. I'm going to go and feel for the popliteal pulses, which are going to be down here by your knees. And these can be tricky to find here. Can you bend up your knees for me just a little bit? Alright. Now we've got the posterior tibial, which, go ahead and take your socks off here just a little bit. Excuse me. Excuse me. Feeling for those feel alright. And then also we've got the dorsal pedal ones here. Alright, and those pulses are strong and bounding, so we would rate that at a +3, 4. Cover it back up here. Next, we're going to go ahead and take a look at your abdomen. We want to make sure that it's flat, non-distended, and we can see that just by taking a look at it here. No masses, no lumps, no obvious peristalsis or vibrations. So that looks normal. We're going to go ahead and take a quick listen to it. We're going to listen in all 4 quadrants. You should hear just regular, kind of like a light gurgling noise. looking at your feet, so let me fix that. Alright, thinking in the 4 quadrants. Okay. Now we can use the bell of the stethoscope to listen to the vasculature. The aorta, the renal arteries, the iliac arteries, and the femoral arteries, and there's going to be up a little higher than the belly button, over to the sides, a little bit lower, and then a little bit lower than that. We can do light palpation, and what that does is it just checks for any sort of tenderness. Do you have any pain with that at all? Okay. And then we can do a deep palpation, which is going to feel more for any real tenderness. And that's going to be 4 to 6 centimeters and kind of a scooping motion. Whereas the light palpation is only 1 to 2 centimeters. Okay. The next thing that we're going to do here is we're going to go ahead and see if we can't palpate your liver. Now there's a couple different methods, but I prefer the hooking method. And we're just going to go ahead and lift your gown up here a little bit. And what I'm going to do is I'm going to kind of tuck my hands around your rib area, okay? Alright, just like that. I'm going to have you take in a deep breath for me. And out. And with the deep breath in, you should feel the edge of the liver come down, and with the breath out, you should feel it come back up. I'm just going to have you do that one more time. Alright, good. Now, to assess for the kidneys, I'm going to go ahead and change this out. Put my left hand kind of underneath the flank here, and I'm going to pull to try and bring the kidney anteriorly. I'm going to push down here on my right hand. I'm going to have you go and take a deep breath in. Alright. And down. And now you don't feel anything, and you shouldn't feel anything unless the kidney is going to be enlarged. Now for the kidneys, when they breathe in, you're going to want to kind of try and catch the kidney a little bit and then really bring it closer to you and palpate it from there. With the spleen, you're going to hold a little bit lower, and that one you're not going to be able to palpate either, but unless it's enlarged. Alright, so we're just going to feel for this other kidney on this side, and it's going to be the same method. I'm going to have you take a deep breath in. We're going to try and catch the kidney. When you breathe out, do a little bit more palpation here. Alright, and that's a normal finding that we cannot feel the kidney. So, let's see what we've got. Spleen. We are going to just percuss real quick, a little bit more tapping on you here. Those are all going to be dull sounds. And then we're going to check for tenderness to the CVA area. So if I can have you lean towards me a little bit. Just kind of lean your body towards me. No, maybe sit up a little bit. just going to give you a tap here. And do you have any pain with that?
No.
Okay. What about on this side?
No.
Okay. And that's just checking for any sort of tenderness to the kidney that you might find with an infection. You shouldn't have any sort of tenderness there at all. Now, one last thing that I did want to do, I'm going to have you go ahead and lean back for me. I'm just going to take a look at your fingers here. We're going to look at your capillary refill. And so when we press on your finger, it's going to cause it to blanch and the color should return to it as soon as I go ahead and take my finger off of it. And so that looks good. We're going to check for skin turgor. Just a little bit of a pull here on the skin to tent it up. And a normal finding would be for the skin to go right back down. And we're going to go ahead and take a look at your toes here too and check for your cap refill on your toes. I'm just going to uncover your toes here again. Alright. Same thing with those. And it looks good. We've got normal cap refill on that one. And just take a look over here. Alright, now I'm going to give you a light touch here. I want you to tell me if you can feel it.
Yeah.
Alright. And on this one? Are you able to feel that? Okay. And then I've got a sharper touch here. Let me know when you feel it.
Feel it.
Okay. And what about now?
Feel it.
Okay, good. Alright. That sums up our assessment here. Did you have any questions?
No.
Okay, let me just wash my hands here. Alright, Mr. Smith, I hope you have a great day, and the doctor will be in to see you shortly.